This was her surgical picture. Her defect was almost about 14 millimeters by 14 millimeters. For me, I think for the last maybe 25 odd cases, my go-to is now sutures. So number 2 vicryl is what I use. Prepare the crater of the defect. Make sure that you make some good holes for regeneration. Pass these number 2 vicryl sutures, maybe 2 or 3 of them. I use some fibrin thrombin tissel glue in the base of the defect, and then you just have to probably trim down the fragment at times and tie this off. This vicryl usually will dissolve in about 2 months time and probably not do anything. So Sabrina, are you going to add an MPFL for her? Do nothing? Are you going to restore her pathoanatomy? What are you going to do for her?
I'm going to do an MPFL. I'm not going to
Yeah.
risk that this happens again.
Yeah, I think I'll agree with you. The only one time in one patient whom I did not do an MPFL, she just comes back and she shows me that her patella is subluxing.